first essay is arches of food, isn't it? So when you just observe our food, it is not evenly placed on the floor, but it is highly irregular. Okay. Why is it so? Because it has to adjust on the ground and it also has to support the body. So for that we are having these arches of foot. So basic function is it is supporting the body weight and it serves as a lever to propel body forwards during locomotion. Okay. So now see here in the foot. Now if you observe, see we have two arches. From medial side, if you observe, we have medial longitudinal arch. From lateral side, we have lateral longitudinal arch. So what is the function of these arches? It helps in proportional distribution of body weight to the ground, and it acts as segmented level which helps in propulsive mechanism. Propulsive mechanism in the sense when we are walking, it is helping us to move forwards. Okay. And this irregular shape is also not allowing the sole of the foot to directly touch the ground. In the sense it is protecting underlying blood vessels and nerves. It protects from getting compression. Okay. It acts as a springboard, helps in jolting and jumping from a height. Okay. So now see here, all these are not required, beta. So what are the various arches we have? We have two longitudinal arches. From medial side, if we observe, one we have medial and one we have lateral, and we have two transverse arches. See, from the great toe, big toe, if you observe whatever arch is there from the medial side, you call it as medial longitudinal arch. From the lateral side, whatever arch is there, that is lateral longitudinal arch. Okay. So the medial longitudinal arch, now you just observe this picture, automatically you understand. First of all, let me revise the names of tarsal bones for you. The names of tarsal bones are calcaneus, talus, navicular. We have three cuneiforms named as medial cuneiform, intermediate cuneiform, lateral cuneiform. Okay. So then we have, this is cuboid bone, cuboid. So after that we have 5 metatarsals. 1, 2, 3, 4, 5. These are metatarsals, and we have 14 phalangeal bones. In the big toe we have 2 phalanges, and in the rest of all toes in the foot we have 3 phalanges each. Makes 14 phalanges. So these are the bones of foot. Okay. Now see here. Now medial longitudinal arch, when you define the medial longitudinal arch, it represents so medial longitudinal arch, if you observe this, so what are the various bones you are seeing? You see here we have calcaneus, we have talus, navicular, cuneiforms, 3 metatarsals. These are the main bones which are taking part in the formation of medial longitudinal arch. Okay. So it represents a big arch. When you just look at your own foot, this medial arch is having more height. That means it is more arched when you compare with lateral longitudinal arch. Okay. It represents a big arch of a small circle. Okay. Summit means the most highest point beta where arrow is shown. Okay. So summit of the arch lies at the higher level. So the bones, what are we finding? See, this is calcaneus bone. This is talus bone. We have navicular. We have 3 cuneiforms. Okay, and 3 metatarsals up to their heads. This is the head of the metatarsal, including, suppose in case we have sesamoid bones. What are sesamoid bones? The bones which are formed in the tendons. Okay, are basically sesamoid bones. Sometimes we may have sesamoid bones here also. If they are there, they are also taking part in the formation of this arch. Okay. So the arch is formed by more bones and more joints. So it is resilient. That means what? It is highly flexible, so that it is adjusting the foot at any irregular surface. When we climb mountains, when the stones over the mountains are very much irregular, also we are able to adjust our foot, because we have so many small small bones with many joints, which make it very much flexible, okay, resilient. Okay, so that is it clear, Niharika? Are you understanding?
Yes, ma'am.
Please stop if you don't. Okay. Now see, this is the medial longitudinal arch. Okay, I told you summit is the highest point. Okay, so which is the highest point if you observe? See, among all the bones, the highest point if you observe among all these bones is talus. Okay, over the calcaneus, the bone which is resting is talus. Okay, so the trochlear upper surface of the talus is the summit. You have seen, like I have put one picture which shows you what is the meaning of summit also. Okay, so we have posterior pillar. So posterior pillar, which bone is this? Calcaneus, and we have a tubercle over there. This pointed area is actually called as medial tubercle of calcaneus. Okay, then this is anterior pillar. In the anterior pillar, we have heads of three metacarpal bones. One, two, three. Three metatarsal bones. Okay. So keystone, that means among all these bone, which is more flexible and which is helping in more flexibility is this point, head of the talus. That's the reason it is called as keystone. Okay, keystone. So that is medial longitudinal arch. Then next, if you observe, this is the lateral aspect of the foot. Okay, when you see from the lateral aspect of the foot, now just name the bones. We have calcaneus. I said this is cuboid bone. Okay, then we have the last two metatarsals, and then these are the phalangeal bones, isn't it? So the lateral longitudinal arch you are viewing from lateral side, it represents comparatively a small arch. Previously, I told you medial arch is quite big. You observe in your own foot right now. The medial one is more arch. Okay. So here obviously the height is not so great as we have found with the medial arch. What are the bones you see? Here also we see calcaneus, but the other side we see the cuboid bone. Okay, and fourth, fifth metatarsal up to their heads. That means this point. So all these arch is lateral longitudinal arch. Okay, so arch is formed by less number of bones. Comparatively, it is not as flexible as you have seen with the medial arch. So less joints, but their resiliency was more. Medial side was giving us more of movements, whereas lateral arch is giving us more stability, more rigidity in character. So it commonly bears our body weight before the medial arch. Is it clear? So that is medial arch and lateral arch. Apart from that, I told you we have two transverse arches, right? So if you join the heads of the metatarsals, that becomes the anterior transverse arch. If you join the bases of the metatarsals, that forms the posterior transverse arch plane. So we have two medial and lateral longitudinal arches and two anterior and posterior transverse arches. It will be given in your books. You can study from any book. Okay. Now, when you talk about lateral longitudinal arch, summit, again the highest point is subtalar joint. Sub means what? Below. Below talus, there is a joint between talus and calcaneum. Okay, talocalcaneal joint you have. So that is actually the summit. You call it as subtalar joint. Below talus, hence it is subtalar joint. Okay. Then posterior pillar, you are finding which bone is the posterior pillar? Calcaneus. And this pointed area actually we have, this is actually lateral tubercle, not, I'm sorry, this is lateral tubercle of calcaneus. Then we have these two heads of which are the last two bones? Fourth and fifth metatarsal bones. Okay, and the most vulnerable part here, that means the most stable, like which gives the support in this, is calcaneocuboid joint. This one, calcaneocuboid joint. Okay, then apart from that, I said we have two transverse arches. Two transverse arches. This picture was good for you to make you understand. This is anterior, I said. One straight line here, one straight line here will help you understand we have other than this two transverse arches also. So when medial borders of both foot are approximated completely, transverse arch is formed. That means you see this is our right foot, left foot, you are trying to join both the foots, then you will see the complete transverse arch is formed like this. Okay, then each foot represents half dome with concavity. This is half dome, this is half dome, and concavity is this one which is directed downwards and it is near midline. Okay, so what are the series of arches? I told you basis of simple way you remember better. It becomes easy. In our books also it's given. Heads of the metatarsals form first anterior transverse arch. Basis of the metatarsals becomes posterior transverse arch. Okay, so we have two like two longitudinal arches. One is lateral longitudinal arch and the other is medial longitudinal arch. Two transverse arches, anterior and posterior. Okay, then what are the factors which maintain these arches of foot? How is that the bones are not directly going and touching the floor? What is it making to avoid the direct contact with floor? See, like we have the engineering devices have been actually devised on the arches of foot mechanism. If you observe the shape of bones, no shape of the bone is flat. You can see they are very much irregular, wedge shaped bone. One is some shape, the other is some shape. No bone is very much flat or rectangular or square to rest on ground. So that is all bones are very much irregularly shaped. Okay, wedge shaped bones and intersegmental ties. That means you have between the bones we have joints, and also when you see the muscles which enter from the leg to the sole, they are inserted into various bones in such a way like they hold the arches in position. We will see all these things. Okay, now let us see first, this is our medial arch. So when you see the shape of bone, what is the name of this bone? I said calcaneus. Is it resting on ground? No, it is just directed upwards, isn't it? So you can see talus, you can see even this is also not flat. No bone of the arch, either you view from medial side or lateral side, is flat. So shape of the bone is wedge shaped with thin edge directed to plantar surface. Plantar is the one which is resting on ground, is called as plantar surface. Okay, this is the head of the talus, which is the center of the arch. I already told you it is called as keystone because it is acting as a main pillar. Okay, in the front what bone do we have? Navicular. What is the name of the joint? Talonavicular joint. Talonavicular joint. Okay, so next, overall this area where the foot is resting, the part of the calcaneus, you call it as sustentaculum talae. Sustentaculum talae is the part of the calcaneus bone over which medial longitudinal arch is resting. Okay, so like that. So you can see in this arch which is made artificially in our like walls, you see there is a keystone in center. Similar type of keystone in our medial arch is talus. Okay, now, similarly, between these bones, I told you we have certain joints and holding ligaments. So that those are intersegmental ties or tires supported by plantar calcaneo-navicular ligament, that is spring ligament. Okay. So whatever, now see, I told you the muscles which are seen on the posterior compartment of the leg, they will be entering into the sole. So what are the muscles we have in the posterior compartment? We have tibialis posterior, we have flexor hallucis longus, we have abductor hallucis. All these muscles, if you observe, they are actually inserted in such a way, they are not just like connecting them to rest flat, but in fact you can see they are suspending the sole as though to pull it up, to hang it up. You can see the tendon of flexor hallucis longus, you can see the tendon of tibialis posterior. They are called as spring ligaments. They are actually trying to hold the medial arch in such a way that it is pulled upwards. Okay, so that is. permanent stretch which is not allowing the sole to directly rest on the ground. Okay, this is actually maintaining the medial arch. This is not letting the foot to rest flat on the surface, but it is maintaining the arch. Okay, that is. We have tie beams also. So the plantar aponeurosis, when we study sole, when we do the dissection, just below the skin we have plantar aponeurosis. Okay, below which you will have abductor hallucis. We have many other muscles in the soles like flexor digitorum brevis, flexor hallucis. Longest comes from behind. Always longest muscles are coming from leg, posterior compartment of leg. Okay, flexor hallucis longus, flexor digitorum longus, flexor hallucis brevis. You need to just memorize these muscles. They are actually acting as tie beams so that the bones are not directly resting on the ground. They are just held in such a way like they are being protected, because underlying blood vessels and nerves are there, and the sole is so designed to adjust on irregular surfaces, like when you climb on mountains, hills, you imagine. So all these muscles are held in such a way like they hold the bones in the form of tie beams. Okay, so now you can see those muscles. Once you remove the skin, I said we can see plantar aponeurosis. This is flexor digitorum brevis muscle. Okay, then you have seen like this is the flexor digitorum accessorius, flexor hallucis brevis, okay, lumbrical muscle. So all these muscles we find in sole. Okay, then suspending arch from above. So what are the muscles? We have tibialis anterior also. This is also is suspending from above. What is this? Flexor hallucis longus. Okay. So this is suspending arch from above. Deltoid ligament is seen on the medial aspect of ankle joint. Okay, the thickening of the fibers on the medial side of the capsule of the ankle joint is deltoid ligament. Deltoid ligament is seen on medial side of ankle joint. That is also helping in suspending the arch. Okay, from above. Then that was all about medial arch. Similar things, only names of muscles will be different. Okay, because this is lateral view now. So this is the lateral longitudinal arch. Now we know the shape of bone is very much irregular, and here the keystone is cuboid bone. Okay, keystone is cuboid bone. Okay, and its triangular projection also you can see, which is actually helping to tilt this lateral longitudinal arch upwards, upward tilt of this long axis of this bone, actually this calcaneus. Okay, and here also we have these intersegmental ties. So how are these produced? By these ligaments which are found on the sole. Okay, so what are these ligaments we have? We have long and short plantar ligaments. This is long, which is connecting the calcaneum to the bases of the metatarsals. Okay, this is long plantar ligament. Small short plantar ligaments are seen, which are connecting small bones in between. Okay, between the cuneiforms, between the cuboid and calcaneus, you have short plantar ligaments. Okay, so then we have tie beam. Okay, so the tie beam is again plantar aponeurosis, but this is on lateral side. No, the names of muscles will be different. Okay, little toe muscles, abductor digiti minimi, flexor digiti minimi brevis, then flexor digitorum brevis and longus tendon. Okay, they are actually acting as tie beams. Tie beams in the sense that suppose if all these are bones, these bones are not allowed to rest on the ground directly. They are held in such a way that they are very much irregular and they do not come and touch the ground. Okay, that is the function of tie beams. Okay, various muscles and ligaments. So again the same picture I kept to show you the sole muscles. Now see this muscles on lateral aspect. We have flexor digiti minimi brevis, we have abductor digiti minimi. Okay, so this those are the muscles from the lateral side. Suspending arch from above, we have tendon of peroneus brevis and peroneus tertius. Peroneus brevis actually is a muscle of lateral compartment, and peroneus tertius is a muscle of anterior compartment of leg. Okay, you need to memorize these names of the muscles which keep the arches in position. So many muscles, and basically you see muscles of the leg. In the leg we have three compartments: anterior compartment, posterior compartment, lateral compartment. All three compartment muscles are coming in the sole only for insertion, and they are inserted in such a way like they form different tie beams, tires. They hold the arch in position. Okay, they are suspending the bones from above. For example, now you can see peroneus brevis and tertius. One is from lateral compartment, one is from anterior compartment. They are holding the lateral arch from above. Prevents the bones from resting to the ground. Okay, so like that you can see the various bones. This is peroneus longus tendon. Okay, coming from the lateral compartment. It is holding from above, not allowing this cuboid bone touch the ground. This is the ground level. Okay, so maintenance of transverse arches, I said heads of the metatarsals and bases of the metatarsals. We have anterior and posterior. Okay, so these of course we know, like again these bones whatever we have are very much wedge shaped in nature. Here which bone is the keystone? Here cuneiform bone, intermediate cuneiform bone. How many cuneiforms we have? Three: medial, intermediate and lateral. So intermediate cuneiform bone is the key bone of transverse arch. Okay, basically transverse arches are not so important. Try to focus more on medial longitudinal arch, lateral longitudinal arch. In many books, it is given in the form of a table. Once you understand the lecture, automatically you can just read from the tables. It's quite easy only. Okay, here also again in this transverse, among the transverse arches also we have intersegmental ties which are formed by deep transverse ligament, other intrinsic plantar ligaments, dorsal interosseous muscles. As you can see here, you can see the ligaments also, deep transverse metatarsal ligaments. Okay, see adductor hallucis. Hallucis muscles always you have to check with big toe, great toe, that is adductor hallucis. Digiti minimi word is used to represent little toe. Hallucis word is usually used to represent big toe. Remember this terminology. Okay, interossei are the muscles which are found between bones. Okay, so here also for transverse arches, again you this is all your memory work. Tie beams, we have tendons of peroneus longus and tibialis posterior. Suspending from above, we have peroneus tertius, brevis from lateral side and tibialis anterior from medial side. Okay, so that finishes your arches. So we have one medial arch, one lateral arch and two transverse arches. So once you are done with the arches of foot, we have certain deformities. Unfortunately, in some people, you will see the arches of foot are not developed and they suffer with a condition called as flat foot. Your question may be designed in this way also. A person has come with pain along the distribution of the nerves which are present in the sole region. He is unable to rest the foot on the ground, and so what is the clinical condition? What is the, again you write the gross anatomy of the clinical condition which is being described. So in that way, like you will be given a small clue with the help of which you need to identify your question. Okay, so flat foot or pes planus, you see disappearance of arches of foot. So it is usually due to abnormal weight distribution on arches or loss of muscle tone in leg due to prolonged standing. Some of the professions will demand prolonged standing. No, in such people usually it may be loss of arches. So predisposing factors: faulty footwear, that means high heels or something like or bad walking posture, long, slender, or rapidly growing foot. That is also one reason. Obviously, nerves will be compressed and producing pain in metatarsal region. Metatarsals at this point, right? So this point, lot of pain will be there, and the pain is radiating towards toe. You call this condition as metatarsalgia. Metatarsalgia. Okay, this is flat foot. Quite opposite to flat foot, sometimes the arches may be highly exaggerated. Instead of this much arch, if you see very much highly arched foot, okay, that you call it as high arched foot. Okay, two different things we have. We can check with footprints also. This is normal footprint where you can see the medial longitudinal arch and lateral longitudinal arch. This is the footprint of a person who has flat foot. Okay, in highly arched foot, you will see this point will not come and touch the ground at all. Okay, you call it as pes cavus. Pes cavus. This is pes planus, where the foot is flat, and highly arched, you call it as pes cavus. Okay, see, highly arched, this one. Okay, exaggeration of the longitudinal arches. You can see the plantar flexion at the transverse tarsal joints. Anterior part of the foot drops below the level of posterior part, like that. You need not describe so much, at least one or 2 points are also enough. So apart from that, you have different types of clubbing, not required. Only those two things you remember enough. Alex valgus is also not required. But this type of deviation, generally we also see with gout. Uric acid crystals are deposited, I said. No? So there can be a condition called as hammer toe. Okay. So that is all about arches of foot. So what is our next question? Liver. Okay. So till I start liver, try reading arches of foot. See, uh, in the liver topic, I found the histology of liver first, so I thought I will discuss histology. So when you just draw the histological aspect of liver, you have to draw hexagonal hepatic liver lobules like this. Okay, hexagonal hepatic lobules. So these lobules are separated by a very scanty connective tissue. Even this much connective tissue also is not seen in the slide what we use. Okay, so the lobules are merging with each other. So when you just try to know the details of this liver lobule, each liver lobule, what does it contain? See here, each liver lobule will contain a central vein. Okay, so surrounding from the central vein, whatever brown colored structures are shown, these are all hepatocytes, all radiating hepatocytes you are supposed to draw. Okay, in between the hepatocytes, this violet area is shown. That violet area is actually representing sinusoids. Okay, so these are venous sinuses, sinusoids. Now, apart from that, you are also finding green lines. What does this radiating green lines indicate? That means from each hepatocyte, bile juice is being collected by this biliary canaliculi, and it is coming and getting collected into the bile duct. Okay, that is the meaning of this green colored duct. Now, that means when you draw a hepatic lobule, you should show all these labelings. You should show central vein, radiating hepatocytes, venous sinusoids, biliary canaliculi. Now, when you use the word liver lobule, it is hexagonal in shape like hexagon. Now, when you see and check at each corner of hexagon, we have portal triad. Portal triad in the sense we have three structures at each corner. What are those? Hepatic artery, portal vein, and bile duct. Hepatic artery, portal vein, and bile duct. These are the three structures you see at any corner. Okay, that is the meaning of liver lobule. So you can just take the photograph of this slide, but don't use these colors. This is only for your explanation.